Hi, my name is Sabrina Soares, and my um, honors project was done on evaluating health literacy levels in college students. So, just for some background, according to the CDC, health literacy is defined as an individual's capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. And this is a vital component of understanding one's health. Health literacy includes basic literacy skills, knowledge of health topics, and numeracy. And for a little bit more background, in 2003, a national assessment of adult literacy was conducted, and this produced the first national assessment of adult health literacy. This concluded that only 12% of adult Americans exhibit proficient health literacy levels. Lower health literacy levels have been linked to a low adherence to treatment, decreased ability in healthcare decision-making, increased hospitalization rate, and greater inpatient spending. Studies have shown that individuals with low health literacy levels have unhealthy lifestyle behaviors and poor management of current health conditions due to the lack of understanding of health education, resulting in ineffective or absent management techniques. The CDC has also stated that low literacy levels are related to the development of chronic health problems, which may be preventable at the earliest symptom. The purpose of this study is to identify deficits in health literacy levels in order to determine if undergraduate college students are at risk for the development of future adverse health outcomes. I decided to focus on this population because it is underrepresented in the literature as the focus of health literacy education. Typically what we see is that health literacy levels are done on generally older adults who may or may not have a college education and who already have one or more chronic health conditions present. Since these studies are typically done on people who already have these conditions present, screening for health literacy levels has little effect on preventing these conditions or the possible development of additional comorbidities because they have already been developed. So we're not seeing whether or not their literacy levels are impacting their future health. It was my thought that additional years of education through university or college may affect this outcome because in college students are challenged in their reading, writing, critical thinking skills, math skills, and this is across multiple courses of study. Some of my research questions were, what are the levels of health literacy in college students? What are levels of numeracy in college students? Do health literacy levels differ in college students by gender or major? And how do these levels in university students compare to the general American population as previously reported by the National Assessment of Adult Health Literacy? For some of my methods, the design of the study was descriptive and cross-sectional. The procedure was IRB approved and it was obtained through the university. The IRB has also waived signed consent due to minimal risk involvement to participants. And for the sample, it was students who were completing degrees in various fields. This included 74 participants from the UMass Dartmouth campus. Some tools that I use were a self-created demographic sheet, the newest vital sign, and short tests of functional health literacy in adults, which are all valid forms of tools. This is just an example of the newest vital sign. It consists of a nutrition label here and then following questions that pertain to the label. These questions require basic numeracy skills. To determine the score on these, a score of 0 to 1 suggests a high likelihood of 0% or more, 50% or more of limited health literacy. A score of 2 to 3 correct indicates the possibility of limited numeracy, and a score of 5 to 6 correct almost always indicates adequate numeracy levels. Then I use the S-TOEFL. So this is a measure for reading comprehension skills, especially for health-related material. So here we have passage A, which is very simple. It was written in a 4th grade level. And then here we have passage B, which was written in a 10th grade level. The scoring also indicates different levels. So 0 to 16 correct indicates inadequate functional health literacy. 17 to 22 correct is marginal health literacy. And then 23 to 36 correct is adequate functional health literacy. The demographic sheet included age, year of graduation, major, gender, hours worked a week, hours spent on studying or homework a week, extracurriculars, sports participation, grade point average, and participation in the honors program, as well as financial aid. These are the results. So table 1 shows the mean scores across the majors for all the newest vital sign and the STOFLA. So as we see here, we see that engineering did the best on both categories, and then business also did not as well on both categories, all across the majors too. For the results on comparing gender differences, there weren't any significant results, but we did see a little difference. This is an independent t-test comparing gender differences for the newest vital sign and STOFLA. So we can see that on the STOFLA, we have females who did a little bit better. This is the reading comprehension. And then the newest vital sign, we see that males did a little bit better than females, which was the numeracy part. I also have this table here. This is just showing an average of the scores on individual tests for all students in general. So we have a valid score is 0. So these are students that did not score well at all. These were the ones where the students were found to have poor health literacy levels. And we see that 6 students scored here, which is 8.1% of the sample. A score of 1 was attributed to people who did a little bit better. It indicates limited numeracy levels. So we see that 7 students for a total of 9.5% scored here. And then a valid score of 2.0 was given to students who scored adequately. So we see the majority of the sample, which is 60 students, and 81.1% of the sample scored adequately on the newest vital sign. And then here we see the scores for the STOFLA. So luckily, all students scored adequately, which is great. This is what we want to see. So some of the limitations, the sample size was a limitation. I was only limited to undergraduate students at one university, which results in a homogeneous sample. And some testing fatigue and errors. I noticed some questionnaires were blank or incomplete, especially towards the end. And the last survey that I had given people was the numeracy one. So I think the questionnaires may have been too lengthy for participants. They might have required more time. And I think a lot of human error might have been attributed to testing fatigue as well. The conclusion and implications of the study: the students surveyed had better health literacy levels than the general adult population surveyed by NAAL. However, there were deficits that were identified, such as the differences between majors in their scoring. The students who did not fill out certain portions of the questionnaire, some who only answered halfway through and then stopped, and then the human error or the errors in general that were included on the survey. I think furthermore, the population is underrepresented in the literature again as the focus of health literacy determination and education. And I think by surveying young adults, deficits may be identified early and corrected to prevent poor future health outcomes for these students. And here are my references.